Hi, everyone. I'm happy to bring you this case study with Laura Griffin, and really excited to be talking to you today about employee engagement. Laura, why don't you introduce yourself to us, please? Tell us a little bit more about you and your health system.
Sure, thanks, Vicki. Hi, my name is Laura Griffin. I am the Vice President of Nursing Operations and Strategy for the Allegheny Health Network. I have been in executive nursing for about 2 years and 6 years within our system. And our health network has 8 hospitals and a little over 4,000 nurses.
Wow. Okay. And you guys are in Western Pennsylvania?
Yes, in Western Pennsylvania.
Okay, great. So before we dive into the positive results from your most recent survey, let's go back to December 2017 when you all first spoke with me. What was happening and why did you reach out?
Sure. So back in 2017, we took our first employee engagement survey with the Gallup group. And when we reached out to you, we had just really finished digesting the results, analyzing, and trying to come up with what our action plan as a network would be to help advance the engagement scores. And so through some investigation and some studies around what we could do, we decided to reach out to you, Vicki, to engage in your employee engagement virtual accelerator program.
Okay, great. So tell us about why you decided to use the approach of a live workshop and the books and the virtual coaching program all together. What was the thought process behind that?
Sure. So, in nursing, there are various different types of learners. So we knew that we wanted to be able to hit people on multiple different avenues. What we did was we took the workshop approach for our leaders. You came on site, you really invigorated everybody, got everyone excited about employee engagement, and talked about the challenges. You were very realistic with the team about this isn't going to be an easy hurdle to jump. And so having you on site to really ignite that fire, that spark for the team was extremely helpful. And then the book we had as a supplemental material to send home with all of the leaders to really continue to be able to reference back to that. And then the biweekly virtual coaching program was really the staple to what we were able to do, because every other week the leaders received a virtual really coaching session from you to be able to implement different tactics and go out and help improve their engagement across the network.
Awesome. So I know a lot of leaders struggle with how to effectively conduct employee engagement survey results meetings and create action plans. And that was something that we talked about. How did that process change as a result of what the leaders learned at the workshop?
Yeah, so, in the beginning, when we looked at the employee engagement results, we didn't really know where to start. We had a lot of different planning going on in the organization for many different initiatives, and we didn't want this to be just another thing that the team had to do. So when we brought you on site, what you were able to do with the team was to break it down for us, to help it make it seem a little bit less like an intensive process. So you really broke it down. You made it pretty simple for the leaders. They got the toolkit that they needed to be able to go out and successfully meet with their teams and customize their plans to their units. So it wasn't one big, here's Allegheny Health Network's plan to action plan for employee engagement. It was really customizable down to the staff level for each individual unit. And you made that so simple for everyone to walk away with. And that's what really the value was for us, is that everybody had to have that, or was able to have that customizable plan.
Awesome. Thank you. So how did the leaders' participation in the Engagement Accelerator virtual coaching program impact engagement during the year? You said that was kind of the staple. Tell me a little bit more about that.
Sure. So throughout the network, every leader received their biweekly subscription to your program. And various points throughout the year, we would send out reminder emails. I would send out to the leaders where their participation levels were. It was almost like a competition in some hospitals, that they would say, hey, I'm leading the pack this quarter for our engagement numbers. And then Claire and I, our chief nurse executive, went out and did, a mid-year review of nursing at each of the facilities. And one of the metrics that we used as a part of our review was the percentage of leaders who participated actively in the engagement accelerator. So they really saw all year long that this was something that was important to us. It wasn't necessarily something that just was important to their CNO or something that we introduced at the beginning of the year and didn't talk about later. The other thing that was pretty cool to watch was some of our hospitals actually had viewing parties. So
yeah, I was going to ask you about that. That's great.
Every couple of weeks, they had their CNO and some of the leaders got in a room together and viewed the program, one or two sessions of it, and then they had active discussion around what those tactics were that you introduced and how they might be able to approach that at their hospital. So that was pretty cool to watch.
Awesome. I think that's what really made a difference for you all too, was
Absolutely.
First of all, you and Claire talking about it, and then the fact that people were watching it together. I always recommend that to other new clients when they're working on it. So let's hear about the results of your most recent employee engagement survey, please. How did you do? What was the correlation, et cetera?
Sure. So the most exciting thing for us was that our participation rate within nursing at Allegheny Health Network in the overall survey went to 80% this year, which is a huge leap year over year. Woo! Yeah. So we're very excited that the overall participation increased significantly. Along with that, our scores also increased. So we were able to increase by 0.12 in the core behaviors category and 0.11 in the basic workforce needs. So when you're thinking we're surveying, over 4,000, 5,000 people in nursing, that is a pretty statistically significant number to go ahead and move forward.
That's great. And I know that Claire had told me that the leaders who participated in the virtual coaching program, tell us about how their results compared to those that hadn't.
Yes, so we also saw that the hospitals who had the highest levels of participation, particularly those units whose leaders participated actively and actually demonstrated that they had different tactics that you shared with them, that they used those on a regular basis, their scores did show improvements, both in participation and in the overall mean averages.
That's awesome. So now that you've been working on this for a little bit over a year, what advice do you have for other healthcare leaders who are trying to improve and sustain engagement?
I think it's all about finding a balance and finding a way to infuse different activities across your system, across your hospital around engagement. One of the things that we learned was it wasn't about all the big grand gestures. It was as simple as finding out the different ways that your staff might like to individually be recognized. So it does not take as much to move the scores slightly as you would think. But we had an entire year of activities around that, and we really just built the foundation. We can't stop now. It's something that we're going to continue to do and move forward with. We're going to use your principles. We have your book. We still give it to all of our new leaders who are on board with us so that they have that toolkit as well, because it's very important. And moving the scores, it does take a lot of work. We've just begun our journey, and we're excited to see where we continue to go year over year with enhancing the principles that you've given us and continuing to use that in our staff and our network.
That's awesome. And I know that will pay off for you all, especially with your patients, of course.
Yes, of course.
For the organization in terms of getting those nurses, not only having them stay, but having them more engaged and feeling more connected to what matters most to them.
Absolutely.
So I really appreciate your time today, Laura. Anything
Absolutely.
else you want to add that I haven't asked you, or are we?
I don't think so. Just a special thank you to you and all of the time that you spent with us. You stayed constantly connected throughout the program, and it was something that, for me especially, being sort of your main contact with us, I felt very important because, a lot of programs, you don't get to have that constant contact. You get a one touch here and there, and I felt like you were along this journey with us the entire way and still are, and still available to us if we need you. So we so appreciate that.
Thank you very much, Laura. Well, this has been great. I really appreciate your time today, and I know that we will continue to talk. And thank you so much for sharing this story with other nursing leaders out there.
Absolutely. Have a great day.
You too.